Hi, it's Dr. Lorn, and this podcast is for information and educational purposes only. It does not constitute medical advice. It is not a substitute for professional diagnosis, treatment, or consultation with a qualified healthcare provider. If you are experiencing depression or any mental health concerns, please consult a licensed medical professional. Hello, everybody. This is Dr. Lorn Allison with the masterofthebody.com podcast. And today I want to talk with you about depression and treating it with natural methods that are extremely effective. And I'm talking about depression all the way down to severe depression. Now, anyone who has severe depression, meaning, they're seriously contemplating not wanting to live anymore, obviously you should be taking every step available to get you out of that state. And if that means conventional methods or an emergency room and so forth, then that's what you need to do. And then you can work on correcting after the fact. But you should always seek what the care that you need at the time that you need it. So that being said, if you are looking to treat depression naturally, then the good news is there are quite a number of things that you have the ability to use that can be extremely helpful. Now, the caveat is, as a doctor and having a clinic, that I would tell you that you need to be evaluated properly, of course. Now, many people will go into the health store and they will buy something like St. John's wort or SAM-E, which do have their clinical significance with respect to treating depression. But I can tell you that in my clinic, I don't even use them. And the reasoning for that is that we found things that work better and faster, much faster, especially when we're dealing with situations that need to be brought under control and brought under control quickly. There are a number of different supplements that can significantly help with this. Some of them you have probably heard of if you've been doing any researching on your own, and some of them you may not have heard of. So without delaying, I will tell you something along the lines of like omega-3s. Well, a lot of people have read about omega-3s, and they have read that omega-3s help with depression, and that is true. But you have to get the dosing right. And a lot of the time has to go with weight. And so if you are a person who weighs, let's say, 200 pounds or 250 pounds, many times you would have to take well over the normally recommended doses of omega-3s that have been used in the research for heart health. That is something that we evaluate when we are looking to use omega-3s for the greatest impact on something like depression. So you need significant amounts. Now, I would really be barred from recommending exact amounts because it's not really appropriate to just throw numbers out when you're not really sure exactly what the person's situation is. And generalities are okay, but they tend to not work for large groups of people. Certainly, I don't want to recommend certain amounts for two reasons. There's a legal issue, and the second reason is that it's accuracy. Many times you have to tweak these things on the go, meaning a person of 200 pounds that comes in for depression may have been recommended or read about taking 4,000 milligrams or 6,000 milligrams of omega-3s to see if that would help. And maybe it does and maybe it doesn't. And if it doesn't, you have to look at the whole picture. Omega-3s may just be one part of a number of things that you would use to treat depression. There are other minerals, there can be amino acids. You have to look at exercise, and most people, I assume everybody knows that exercise has a massive effect on depression. As long as you're not over-exercising. Certainly you could overdo it and it will push you in the opposite direction. But generally speaking, exercise is a fantastic treatment for depression. So if you want to use it in conjunction with other things, because from the experience that I've had clinically over the last 15 years is that Not every single thing works for every single person, and obviously there can be certain mixtures of things, exercise and certain supplementary protocols. Everything from that to breathing exercises can literally put the person back in control, and then depression is not an issue anymore. So as far as that goes, like dosing or a certain amount of exercise that would go for everybody, exercise is one thing that you do either moderately. Some people go to extremes, but then there's a backlash to that and they feel great, and it runs into the same pattern of then, they feel great and then they feel not great and depressed, and then they almost have like an anxiousness or anxiety and a feeling over the top great, and then they go back to feeling significantly depressed. And sometimes these things can take a little bit of tweaking and a little bit of time, especially with these pervasive cases, people who've had chronic depression since they can recall. And so we come at it from pretty much every angle that we have been able to find, like I was saying, nutritionally, exercise, breathing patterns, depending on that person. And so most of the time, if someone has very, very mild depression, they may be able to go and get just a basic supplement from the health store, and all of a sudden they feel so much better, maybe St. John's wort or SAMe, although I have to say far less than 10% of the people I've seen, even with appropriate dosing, do well on those for depression. The protocol that we have established over the years is a very successful protocol, and it is very individualized, and so we have tailored it to the person's scenario. There are some lab tests that we might run when it comes to trying to delineate where the issues come if we don't get the protocol down well, but in most cases it does not take more than a few days to a few weeks to get significant changes. But it is not, in most cases, just supplementary. It's lifestyle and dietary, because regardless of what a person reads somewhere, these are significant issues, and you're really not going to get any long-term change if you are having to be wholly dependent on dietary changes or just supplement changes and not much in the way of activity levels. Depression tends to get into the body, and if the body is not moving in the way that it should be, then it lends itself to not just a physical depression that is a feedback loop into the nervous system, and the nervous system gets depressed. I mean, there are what seems to be endless amounts of studies at this point as to movement, exercise, and neurotransmitter function and overall mood stability because of exercise and fresh air and so forth. And of course, diet is a major factor, and temperament is a major factor. But these things can be modified, and modified quite easily, and built into habit. And once they are built into a habit, then the person does generally very, very well. So then our goal from a clinical standpoint is to get them away from all of the supplementation and have their life basically go the way it should go with diet, lifestyle habits, and changes with respect to the overall perception and the way that they deal with certain things, because a lot of it ends up being in the mind as well. And I don't mean, or frivolously talking about the mind and their state of mind and their perception. I mean their observation of the world and the way that they have built up a certain way of looking at things and dealing with things. Many times this is dealt with simply with supplementation and changing neurotransmitter balance, because the neurotransmitters certainly affect or color your perception. And so if the neurotransmitters are coloring your perception, then there is going to be an issue with the state of the mind. And it can be both ways. So the person can perpetuate that problem with a pattern of thinking. And we want to make sure that we're covering all bases with that, because not just nutritional lifestyle, but breathing and their mental outlook. It's a very generic thing to say, oh, it's your mental, it's your perspective, or it's your mindset. But there is patterning clearly that goes on in the human mind, and it is either capable of responding to physical issues or it's capable of creating physical issues. And then you have a scenario where it's the chicken or the egg. This can be the issue because once you've corrected certain nutritional issues, but now you have a perpetuating problem with the perception or the state of the person's belief system in terms of who they are, what they're trying to accomplish, and the way that they respond to challenges and so forth. So it isn't just all physical. Sometimes the field of psychiatry and psychology is very helpful, and sometimes it isn't. It's hard to distinguish when that might be. Certainly, I would never recommend someone not getting that type of care for depression or anxiety. But we find that many times people don't respond as well to those if they don't have the nutritional components in place. And some basic protocol changes in their lifestyle, which may include meditation. And there's, again, so much research at this point on meditation as well as a way to mediate depression, that it is staggering that these types of treatments are on the fringes still of medicine with respect to depression, because they are so effective. Everything from omegas to exercise to meditation, and yet many doctors just kind of throw them around as just like, oh, it's a cute thing to do and maybe it helps, but if you don't do it, no big deal. We know from the research it's a huge deal, and how important it is for people to have some type of practice or to get into a routine. And obviously, breaking out of that routine can also provide excitement that keeps things new and refreshing for people, that keeps them from slipping into a depression. So it's too much of a good thing, when people have a regular pattern that they follow every day, but then they still have to leave room to step outside of that pattern and experience new things and go and have fun and so forth. But the majority of what I'm talking about is the basic things that we know are researched that lend themselves to a body-mind complex that is stable, that produces neurotransmitter balance, that is very favorable, quiet time to themselves, because even if a person is a really, really outgoing person and they kind of recharge around other people, they are still going to need some downtime. And yes, those people do actually get depressed, albeit usually not consistently. But everyone needs recharge time, and we have techniques for that, along with the meditation and, of course, breathing. And if you look at the masterthebody.com website, you'll see we emphasize breathing significantly because we can change dominant brainwave patterns with breathing. Some of the things that have been attributed to some supplements is their ability to change brainwave states, like L-theanine, driving alpha-dominant brainwave patterns. Well, you can actually do that with your breathing pattern, and you don't even need the supplement. Now, I'm not saying that the supplement isn't beneficial, but there are other ways to do it where you are performing autonomic controls, as it would be called, or self-regulation. Those techniques are extremely effective. It's just a matter of spending the time doing it, reorienting yourself to spending time on the things that keep you balanced. Here at the clinic, we obviously provide those services in terms of straightening out any issues with nutritional function, physiologically and metabolically, habitual patterns that are very, very helpful to people, exercises that would be helpful, not just physical body exercises, but breathing exercises, mental imagery. Mind control is probably not the best terminology because really you aren't controlling the mind, but you're directing it. And some of those perceptual shifts can make a huge difference in the way a person continues to live their life and whether or not they're going to restart certain issues even once they've gotten a good place, and then all of a sudden they find themselves battling the same thing. Many times that is nutritional, and many times it's a circular issue caused by mental imagery and, or as people like to say, mental programming. And these are very, very real factors that can be dealt with, and there is real science behind them, the protocols that really do help. So again, it is really hard to recommend, generally speaking. I know a lot of practitioners do recommend general supplementary protocols and so forth for depression, but I can tell you from about 15 years of clinical experience that treating depression with generalized concepts and general supplementation, or I read online that I can go and buy, these herbs and or these amino acids and I'm going to feel better. And if they get lucky, they'll grab the right thing and they'll take the right doses. And if they have a mild issue, then they'll get better very quickly. And voila, that's great. That's great for them. But what we deal with is the people that they have already been down that path and it isn't working because they're missing components. For the most part, numerous things will work. It's just they have to be broken up in a specific way and in specific amounts for different people. So you may initially have to give someone several things for depression, supplementary, and then your exercises and so forth, and your breathing patterns to help them get better. But then if you've given them 3 supplements, as an example, what worked for one person where they were taking X dosage, then the next person, that dosage may have to be at 20% of the person who was getting 80% of that same supplement and a lower percentage of the others. And so I know most people are probably looking for specific doses, but in reality, you could throw those out there, but then a person tries it and says, well, it didn't really work for me. That's because you have to have something tailored to that person. Again, unless it's a very, very mild, the occasional, I'm not having a good day, and they take a supplement and they feel better, or in a lot of cases, they just drink coffee and they feel a little better. But there's usually a pervasive existence of it, and those people know who they are, and that typically will require a more specific approach. So I hope that helps people in general to know that there's a little more to it. If you had tried to go and get something from the store and it was kind of not really helpful, then you hopefully have a better idea as to why that would be. This is Dr. Lorn Allison from masterthebody.com. You can visit the website. You can send us questions if you feel like, that's an interesting thought, but I would really like more information, or I have a very specific question about it. You can certainly send those, and we'll respond as well as we can to questions that are not super clinical. Thanks for listening. Take care. Again, this is Dr. Lorn, and please remember that the content shared here in this podcast is not intended to replace professional medical advice or treatment. If you are in crisis or need immediate support, please contact local mental health service, crisis hotline, or emergency services.